Can you guys hear me, see me? It's kind of odd speaking without an audience, and it's so sad not to be seeing all of you and starting my morning with amazing hugs from all over the country and all over the world from our allies and friends. I guess we would only be elbow bumping if we were in person. But thank you all for being so flexible and so patient with our staff as we figure this out. What I keep hearing from people is it's time to get used to the new. I think the one thing that would be the half full perspective of this is maybe more of you get to join us this year from your homes. I'm hoping that today all of you will take a minute to take a selfie to send to me and to your allies so we can see each other in that format. Maybe have a bit of a more social discussion on Facebook. Yeah, I just wish that I was hugging you all, and I hope that the hundreds of you that are tuning in, that you're safe and that you're healthy, and that those that you love are also healthy and safe, and that we're all in a space to take a breath and see what the next few weeks will bring us. With that in mind, I just wanted to start off with a moment of silence for those who are enduring this crisis, that are maybe not as fortunate or privileged as some of us. So let's just take a moment and think of those people and send them our love and our best wishes. Thank you, everyone. So I think that leads us really into what I wanted to talk about to start off this morning. Is just, a lot of people don't have the perspective that I do, or that some of the other founders of Americans for Safe Access have, which is, what the environment was like in 2002 when we, were dealing with a situation that no one in the federal government would admit that there was any such thing as medical cannabis. And we had, these few, I think 11 underground dispensaries at the time that were providing medication for patients that were all facing federal prosecution. Everyone was on edge that ran a dispensary, that they could be raided at any time. And really the only way that the media talked about this struggle was that federal law trumped state law. And so that the federal government had the right to do whatever it was that they wanted to do to these providers. And fast forward to the last couple of weeks here in the United States, where we've seen state after state put medical cannabis businesses on the list of essential businesses next to pharmacies and hospitals. And that is such a stark difference from where we've come from. And I just want to say thank you so much to ASA staff for being so vigilant and really getting ahead of the crisis, understanding that as cities and states were going to be shut down, and that they were going to be making this distinction between essential and non-essential businesses, that the ASA team jumped into action, put out notices to governors and to the various state medical cannabis organizations, or sorry, medical cannabis offices, making sure that they understood what it was that patients were going to need during this time. Of course, the first step was just making sure that the businesses stayed open, but we have to make sure that after the crisis, there will still be medicine for patients. We need to make sure that that those patients that need medical cannabis now, obviously during the crisis, there are other medical needs. There are still people who are suffering from pain, those who have MS, who are dealing with epilepsy. All of these issues are still affecting Americans, and our medical supplies cannot be interrupted now, nor in the future. So our staff is working with the industry as well as with governments to make sure that cultivation sites stay open, processing sites stay open, so that when we get through this crisis, there will be medication for patients. We're also asking state programs to extend the card program. So for patients who have cards that are expiring, that they just let those last throughout the year. This is both for patients, but also for healthcare workers that probably have better things to deal with than renewing these cards. We've asked that every state allow telehealth for new cards as well as renewals. We're seeing this being allowed for all other types of medications and conditions and prescriptions. And so again, medical cannabis patients should be no different. We've also called on states to allow dispensaries to be a little flexible with how they get medicine to patients. And so far, we've seen most states allow things like curbside pickup, allow new types of delivery. And so, I just want to say, again, thank you to those programs, to those governors, to the directors of those programs that you have made sure that medical cannabis patients have been a consideration during the lockdowns. And, I think I speak as all of our members do, and I say thank you to the ASA staff for being vigilant and staying on this and making sure that at this time of crisis that medical cannabis patients are that their rights and their needs are being considered. So thank you very much. As always, it's such an honor to work with such a dedicated staff. This year, we've been looking at a lot of issues across the state, and as you all know, over the last 18 years, we've made great strides. We've been able to create the first distribution programs for cannabis in the world here in the United States. We've been able to move the concept of medical cannabis away from just criminal exemption to actual safe access. We have been able to create product safety standards for these cannabis products to make sure that the industry that's serving patients is doing so in a way that doesn't create more harm, but also allowed the current medical cannabis industry to exist and to be alongside other industries. We have been able to extend medical cannabis access into places that I don't think any of us thought was possible, including places like Oklahoma. I was born in Oklahoma, and I think I said when I first started ASA that we would know that the end was near if Oklahoma passed. And I think for those of us who have been working on these issues for years, things have happened in a bit of a different order than I think we were all expecting. I thought for sure we would pass federal laws before we would see state programs in places like Oklahoma. And I also thought that we would pass federal laws before we would see movement at the international level. So today you're going to hear from panelists that are dealing with different issues at different levels, but we're also going to hear from our allies and colleagues that are working on international issues and learn what we can bring to our advocacy here at the state and federal level in the United States from some of those insights. And we're also going to learn a little bit more about some legislation that Americans for Safe Access is focusing on. Of course, we're going to continue to improve the laws at the state level. But I'd like to give you a little bit of perspective. Every year, Americans for Safe Access helps pass new state laws. But more importantly, we pass a minimum of 20 laws a year improving state laws that we've passed over the years. And this is a lot of work. I think, I know I'm singing to the choir to ASA members, but maybe some people don't know what it takes to pass a piece of legislation. I mean, starting with getting a consensus across our community is one huge hurdle, and then finding a elected official that is willing to put that proposal forward. Then you have to work with their legal department to make sure that the changes that we're looking to get made are actually going to happen through the language that we've drafted. Then you have to take that language and find supporters on both sides of the aisle. Then it often has to go through various committees. Then it goes to both houses to be voted on, and then it makes its way to the governor's office. And at each step that I just mentioned, we're talking about hundreds, if not thousands, of staff and volunteer time. And over the last 18 years, we've come a long way. For those of you who have read our state of the states reports, you see that every year we're seeing states slowly move to create better laws. But the truth is, even if the states had the best laws possible, with federal interference, there's still going to be a huge gap for those who have safe access and those that are just completely left out. And so over the years, we have worked on, at the federal level, making sure that people weren't going to jail. That was a huge victory that Americans for Safe Access brought to the industry. It was actually stopping the federal raids. And in the early days of Americans for Safe Access, that was really our only goal was to just stop the raids. And it was really through bringing patients and stakeholders together that we really understood what it was going to take to make medical cannabis a part of the medical landscape forever. And when we look back at those victories, it's exciting, and there's a lot that we can pat ourselves on the back about. But I think, especially in days like now, in the midst of this crisis, I think we can all understand the difference between the access that's granted through the programs for maybe some of the more privileged people in our society, and those that are just completely left out. That's why this year we're going to ask our members, of course, to continue to do the work at your local and state level, but to turn your attention back to the federal government to look at creating solutions that will help all patients nationwide forever, so that we're not constantly having to go to our states and local governments and to get them to help with things that actually patients should not have to worry about. And so, today I just want to remind you that while most Americans live in states that have medical cannabis laws, huge percentages, in some states, as many as 90% of the population of those states are not able to participate in those programs. And I just want to have everyone just take a minute and think about these individuals that we have just not been able to make sure get served through our medical cannabis patients. And those are federal employees, veterans, people in jurisdictions with restrictive lists of qualifying conditions. So lots of states, don't allow, all conditions. So people who are in pain, some places just allow epilepsy. So all of those patients are left out. Employees that are subject to drug testing. In many states, medical cannabis is still testing positive for medical cannabis in your system is still enough just to get immediately laid off. Patients in treatment centers, patients in hospice, school-age minors, patients who need to travel across state lines. So when we think about patients who want to go see their children graduate from college, we think about parents that want to go to see their children or their family get married, maybe to go to a funeral. Parents who want to take their children on vacation that aren't able to take their kids to certain states because there's no access for them or maybe their children. people who want to go visit a loved one, or at times like this, people that need to travel to take a job in a new state. These are all patients that could be completely left out of these programs. People that are living in underserved areas. As we know, there are many areas across the United States where there are not dispensaries, where there are not access points. There's a huge gap between the number of pharmacies and the number of access centers for medical cannabis patients. So those people who just happen to live outside of an area are completely left out. Of course, medical cannabis is expensive and is not covered by insurance. So anyone living in poverty, maybe they can use cannabis sometimes, but we know that it's not an option. It's very different than the $10 copay for prescription opiates to be able to go and get the cannabis that you need. And then, of course, we have minors, that aren't allowed to go to school because they aren't able to use the cannabis on site. And then, of course, people who are on organ transplant lists. Since we've started Americans for Safe Access, I think we've lost 24 people who passed away because they were not able to stay on the organ transplant list because they tested positive. And of course, our advocates have been chipping away at these issues, trying to create a larger swath of patients that can qualify for these programs. But until we pass a federal law, these patients are left out. And I've heard many people say that if we just legalize cannabis for everybody, for recreational, then everybody will have access. And I think we all know that from the list that I just read, none of those individuals would be helped by recreational. They would only be helped if we pass federal legislation. So today we're going to be hearing from some of our folks on the ground, seeing how implementation is going. I think from those conversations, we definitely get more of an insight of really just the day-to-day struggle it means. I know that many of the people that are on or who are attending right now have had that experience where you give everything you can to pass a bill, and you think that there's no way that you could work any more, that you could put in any more hours. The bill passes, your family and friends think they're finally going to see you again, and then the reality of implementation hits, and all of that work that you've done could unravel if the law isn't implemented correctly. And then you get through the process of implementation, and then you see the gaps that are there in the law, and you have to start again by creating new legislation. So we're going to hear from many of our members that are in that process. We're going to hear from individuals that are working on the international level, and hopefully gain some insight that can help us with the work that we're doing here at the federal level. And then we're going to hear a little bit about what's happening on the science front. As medical cannabis patients, part of our mission, of course, has been safe access for patients, but also safe access for scientists, beyond passing federal legislation to make sure that all patients have access. We all know that we also are calling on the industry to step up to bring more standardized products and to invest in research so that medical cannabis can be a permanent part of the medical landscape of the United States, and not just a emergency stepping stone to other medications. So again, I want to say thank you all for joining us. Please give us as much feedback as you can on this format. Like I said, I'm so sad that I didn't start last night with a reception with you all, and that I'm not starting today with having hugged most of you from around the world. But I am excited that maybe individuals that haven't been able to join us in the past will be able to join us today. And I'm just so grateful that you're all here, and that you're well, and that you're able to continue this work with us. today we're going to have, like I said, many ways for you to participate. We're going to have the Q&A section. So if you have questions, please submit those and hopefully we'll get to them. And I just have a personal request that that as you're watching the conference today, if you can remind friends of yours, maybe that aren't on, that they can join as well. We're leaving the registration open. We brought the price down so that anyone can join. So if you haven't already on your Facebook page told people how excited that you are that you're watching, please do that now. And then if you could also maybe take a selfie, take a picture of your little ASA conference face and share that with us. I would love to see your smiling faces. This is really hard for all of us at ASA not to be seeing you. And, this is a very important year. But the reality is that this is an election year. So a lot of the work that we need to do this year is at home. And next year, we're going to be working on passing federal legislation, which is when we really will need you all in DC. And so for 2021, I want to see the largest turnout of ASA members in DC, because this will be the time that we will pass federal legislation once and for all. And so starting today, I want you to think about coming to DC next May. I want you to start raising funds and really making sure that everyone knows that it's the year to be in DC. And so I'm going to ask you to use a little peer pressure for next year's conference to bring everyone there. Again, this year is going to be ASA's 18th birthday, and I can't believe that all of you have been at this as long as I have, but it's been so exciting to see how far patient advocacy can change the world. And if you are a new member of Americans for Safe Access, there's still so much to do. But I think because the mission is so large, sometimes we don't really get to take a breath and look and see at everything that we've accomplished. And going from the moment where we started Americans for Safe Access, the time of fear, of really watching our friends go to prison, watching DEA agents bust into facilities and take our medicine, to today where we can openly talk about being patients, and that we're just right around the corner from passing federal legislation to make sure that medical cannabis is available to all. And there's no way that we could have done that without all of your participation. So thank you so much. I'm going to hand it back over to Debbie, who's going to give a little bit more logistical information before we go into the break. And for those of you who are joining us as ASA members, I want to say hello to the family. And for those of you who maybe have not yet become ASA members, I just want you to know this is the coolest club to be a part of. So I hope that after today you become a member, and make sure that all of your friends and family are as well. So thanks again for tuning in, and we're just so grateful that you're here.